Hello. So you may be wondering, what does an abortion actually look like? Well, I'm an abortion provider, and I'm going to tell you what that looks like today. So before a patient shows up in my office, she has already thought about what this pregnancy means for her, and she's made a decision that abortion is the right choice for her. Before a patient shows up, she can be clear and confident and know that this is the right choice. And even in that confidence, she doesn't need to be excited or enthusiastic about making that decision. It's not uncommon for patients to be sad or tearful that they're having to make this decision because the circumstances that has led them to know that abortion is the right way to manage this pregnancy. It's also important to know that when a patient comes to an abortion visit, she can change her mind at any time if she decides abortion is not the right choice for her or she needs more time to make that decision. Once she's in the exam room, the first thing we do is an ultrasound. The ultrasound allows us to date the pregnancy and understand how far along the patient is and what kind of medical procedure would be safe for her. We give patients the choice to decide to see the ultrasound or not see the ultrasound. It's a really personal decision how this patient wants to interact with this pregnancy. This may provide closure to her to see the ultrasound before making this decision. She may not want any interest in seeing it, and that has no impact on her decision. And we give patients the autonomy to do that. After the ultrasound, we provide unbiased, non-judgmental options counseling. We tell the patient, you have the option of continuing this pregnancy, seeking prenatal care to have a healthy pregnancy, and become a parent. You have the option of continuing this pregnancy, seeking prenatal care, having a healthy pregnancy, and not parent, and seek adoption services. And you have the option to legally and safely terminate this pregnancy. If the patient decides that she wants an abortion, then we review her medical history and make sure there's no reason that she couldn't have a safe legal abortion in the office today. In the United States, there are two ways to perform an abortion. One is medication abortion, and the other is surgical abortion. Medication abortion is done using these two medications. Mifepristone in the orange box is a single pill taken in the office. It blocks the pregnancy hormones from supporting the pregnancy and causes the pregnancy to stop growing. 24 to 48 hours later, the patient takes misoprostol in the white bottle to start the uterus contracting, open the cervix, and pass the pregnancy in the safety of her home with a support person. This is essentially inducing a miscarriage and looks exactly the same as a miscarriage that was happening spontaneously. In fact, we use these medications to help patients manage miscarriage when those occur. These medications are 92 to 95% effective, and they can be used up to 10 weeks from the last menstrual period. If a patient decides that medication abortion is right for her, the clinician will go over how to take the medications and what to expect in the coming days. Complication with medication abortion is exceedingly rare. It usually involves heavy bleeding or an ongoing pregnancy. The complications are usually managed in the office, and they rarely require emergency or hospital care. The patient does require a follow-up visit to make sure she's no longer pregnant, and most birth control methods can be started same day or at her follow-up visit. The second option is surgical abortion. Everything you see in this picture is what you need to have a surgical abortion, including me. So let me be plainly clear. Surgical abortion is one of the safest medical procedures performed. I'm an OBGYN. I do major surgery, I do C-sections. This comes nowhere close to the complexity or danger of other surgeries. It takes 3 to 5 minutes, it's done in the office, and it usually requires no to moderate IV sedation. So I'm going to walk you through what this looks like. I confirm that the patient wants an abortion, and I have her sign consent for the procedure. I may give her medication to make her more comfortable and relaxed during the procedure if she wants. I place a speculum, that duckbill instrument used for pap smears, into the vagina to see her cervix, which is the opening to her uterus. I clean her cervix off with some antiseptic solution. I inject numbing medicine, like at the dentist's office, to reduce her cramping during and after the procedure. I use small dilator sticks to open the cervix a few millimeters and place basically a modified straw called a suction curette into the uterus to remove the pregnancy tissue. I make sure her bleeding is appropriate, I remove all the instruments, and I place a long-term birth control if she wants, like an IUD or an implant. That's it. Following the procedure, the patient gets moved to the recovery room. She spends about 30 minutes there making sure she has no reaction to the sedation medication and her bleeding is appropriate. The benefit of surgical abortion is the patient leaves that day knowing she's no longer pregnant. She doesn't require a follow-up visit. She can usually return to most of her activities within 24 to 48 hours, and she can usually start most birth control methods same day or within a few days. Abortion is absolutely essential to reproductive health care and reproductive autonomy. It is safe, simple, and absolutely necessary to ensure that patients have the ability to choose when and how they want to be pregnant and when they want to be parents. Thank you.